Good morning, Professor. My name is Aarti Saini, and I'm a student of Nursing Leadership and Management. Today, I'm here to present my reflection video, and this reflection is developed from the learning objectives of week 2, 3, and week 4. So in this presentation, I will be summarizing the objectives achieved in week 2, 3, and 4, and how these objectives were achieved, what all uh, my abilities or my skills helped me in achieving these objectives. First, let me share the screen. Yes. So first of all, I will discuss the summary of week 2. The learning objectives of the week 2 were mainly focusing on the nursing informatics. So in this week 2, I learned about the nursing informatics. What is the difference between the nursing informatics and the health informatics? So the nursing informatics is mainly focusing on maintaining or managing the health data and the health information for the benefit of the patient and patient safety. And the main focus of nursing informatics is to utilize the technology to enhance the patient care and to collect the evidence-based research to improve the practice, develop information, computer literacy, and skills in order to effectively use the electronic medical record system and other clinical systems. And on the other hand, if we talk about health informatics, so health informatics is a broad term which includes the integration of the healthcare sciences, computer science, information science, and also the cognitive science to assist in the management of healthcare information. And this is the information technology in the health informatics is a broad term, whereas the nursing informatics mainly focus on the patient care and the patient safety and maintaining the records in the for the benefit of the patient. Now, there are certain guiding principles which all the nurses are supposed to follow in to pertain to the nursing information, which are related to the privacy and the security of the information. It is very important to keep the information of the patient private and secure, such as keeping the passwords private, and also the methods or the guidelines for maintaining the records, electronic records, are that they must be accurate and comprehensive, so that whenever it is taken out of the computer through information management system, it provides the clear and accurate picture of the patient. So the overall goal of the quality and patient safety education in nursing is an initiative to meet the challenges of preparing future nurses who will have the knowledge, skill, and attitude necessary to provide high quality and safe healthcare to their patients, and also skills to use the informatics. Now moving forward towards the learning objectives of week 3. The week 3 learning objectives mainly focuses on the role of nursing informatic in Canada. So the Canada Nursing Informatic Association believes that the use of information and communication technologies will add value to the Canadian healthcare system, while decreasing the cost. So to achieve a person-centered model of health and wellness, nursing engagement with digitally connected health services environment is very essential. Now, there are certain guidelines which are being given by the CNA and the CSNS. These guidelines are the set of standards and specifications to electronically share health information consistently that should be safely and reliably. Well, it is also expectation from the College of Nurses that the nurses should be able to use electronic health records and should understand the privacy and security management that goes along with accessing as well as inputting clients' data and information into the health records. Now further, the summarization of the last week 4 objectives, this week mainly focuses on the computer hardware. As we all know, the hardware means the physical components of the computer, such as the central processing unit, CPU, which is also known as the brain of the computer, and monitor, mouse, keyboard, computer data storage, the memory, speakers, and motherboard. So these are such examples of the physical parts of the computer. So it is very important for us, for all the nurses, to learn the basics of the computer so that they can be efficiently use them in order to work independently. Now, the importance of nursing informatics in nursing. The use of computer and information technology to support an electronic health record is quickly becoming a standard practice in healthcare. So the computer system in healthcare increase the quality, safety, and consistency of the patient care by providing nurses with the quick and easy access to the clinical information related to patient's health. For example, features such as e-prescribing allow patients to receive their prescriptions online in an easily and accessible format. Now further, nurses can also benefit from informatics by using electronic health records to do their chatting in the clinical area. The acquisition, storage, and retrieval of that data help nurses and other medical professionals to provide better care to their patients. By using informatics, nurses can stay better informed and administrators can track appointments more effectively. Now further, the informatics also help patients maintain better control of healthcare by and it allow them to access their electronic records so that they can communicate with nurses, doctors, and other staff members quickly and easily. So how this information is useful to me for my future leadership role. So I think this information is very much useful for my future leadership role. As being a nurse leader, I will combine my analytical and medical skills to provide my patient with the highest quality care, and I can use informatics to analyze trends in the patient care or to identify potential errors in delivering that care. So I will ensure that the data is being correctly used. So after meeting all the objectives of 3 weeks, I realized that this information is very much helpful for the leadership role, and it will help in improving my clinical practice by enhancing the quality of care, supporting decision making, and also collaboration. It will enhance the collaboration in team. So being a nurse leader, I can employ informatics to help increase my patient satisfaction as well as the patient safety, and it will help in reducing the errors also. For example, I can instantly access the patient's records to identify potential dangers during drug interactions or allergies. So it will help in patient safety also. So I think my all learning objectives were met, and while reading the content, I understand the concept, and I think my research and my learning, I'm a keen learner, helped me in achieving all the objectives. So this was all. Thank you very much. I hope you like my work. Thank you, Professor.